Patients often ask me, am I too old for a knee replacement? It's a perfectly reasonable question. And yes, age is an important factor when considering surgery, but age is far from the only factor. And what's really interesting is that there are other specific factors that usually impact outcomes far more than age does. In fact, some of my 80-year-old patients have a smoother recovery than some of my 60-year-old patients. And once you understand why, you start to understand what matters most in recovery. So in this video, we're talking about what impact age really has on knee replacement recovery, and which other factors have even more. So let's start by unpacking what people are really asking when they ask if they're too old. What they're asking is this: does my older age significantly increase my risk of complications or a bad outcome? The answer is, in some ways it can, but in other ways it doesn't. To really understand, I think it's helpful to answer a different question first. What is the average age of patients having knee replacement in the first place? The average age is in the upper 60s, so your knee may make you feel old, but if you're around this range, you're actually right around the middle of the pack when it comes to surgery. Now, I'll be honest about this. Older age is linked to higher risk of certain complications, especially as we get past 80 years old. There are more heart and lung complications, longer hospital stays, and yes, even a higher risk of death in the recovery period. Across all ages, not just older patients, studies show that the risk of death in the first month after surgery is around 0.1%. For patients in their 80s, that risk rises to somewhere between 0.1 to 0.6%. But what's really interesting is that for people in their 80s in general who don't necessarily even have surgery, the risk of death in any given month is somewhere between 0.3 to 0.7%. So what's going on here? Does knee replacement protect against death in 80-year-olds? Well, no. It's likely lower in knee replacement patients because they've been medically screened. They've been determined to be healthier than most other 80-year-olds, which is the whole reason that they're able to have surgery in the first place. So the surgery isn't the cause of them being healthier. It's the result of them being healthier. The bottom line is that surgery at older ages can have higher complication risks, but the absolute risk is still low on average. The best way to know where you stand is to talk with your orthopedic surgeon. And yet, here's where it gets surprising, because even though age does carry some downsides, it carries some upsides too. The first one is that older patients are actually less likely to need more surgery on the knee after a replacement. Sometimes more surgery is needed to treat a knee replacement that's loosened, worn out, or having some other problem. These surgeries are called revisions, and on average, older patients need revisions less often than younger patients do. There are a few different reasons for this. For example, older patients are less physically active on average, and that reduces the physical stress put on the implant. That reduced stress leads to less wear and tear on the implant over time, so the chance that it develops a problem that needs more surgery goes down as well. Another reason revisions are less likely in older patients is that, even if it sounds a little crass, an implant only has to last as long as a patient is alive for. For a younger patient, it might have to survive several decades of use. For an older patient, it has fewer years to get through, so it's more likely to last the rest of their life without trouble. And lastly, older patients may be less likely to pursue revision surgery, even if it's an option they're presented with. But there's another upside worth mentioning too. Some studies show that older patients tend to be more satisfied after knee replacement than younger patients. And again, there are a few possible explanations. Older patients often have more severe arthritis going into surgery, so taking that arthritis away can lead to a massive difference. Also, because older patients tend to ask less of their knees from a physical standpoint, they may notice the implant's limits a little less. After all, knee replacement is a very good surgery, but it's not a perfect surgery. It just isn't as good as the knee you were born with. But for older patients with lower activity levels and severe arthritis, that shortcoming may just not matter as much. But satisfaction is just one measure. What about how much your knee actually improves after surgery? That's where most people assume that younger patients have an advantage. But when researchers measure improvement, older patients actually tend to improve just as much as younger patients do. Now, improvement means how far you've come from where you started, and older patients often start from a lower point. So imagine a simple scoring system for how well the knee works. A younger patient might start at a 5 before surgery and end up at a 9 after surgery. An older patient might start at a 4 and climb to an 8. They both improved by the same amount, but the older patient who started a little lower ends up a little lower at their final number. So it's not quite right to say that older patients always end up right where younger patients do. What is true is that older patients often have very similar improvements compared to younger patients. Age doesn't automatically mean that surgery can't help. So we've now seen both sides of what age does. But when it comes to predicting how well patients will do after surgery, age just isn't the best marker for that. So what is? To be honest, there's no single best way to measure that. But study after study shows that a person's overall health is a far better predictor of how they'll recover after surgery than age by itself. There's a name for this bigger picture of someone's overall health, and it's called frailty. Now, we all have an idea of what frail is, but in the medical sense, it means something more specific. Think of it as your body's reserves. It's a measure of how well you'll be able to handle a major physical stress like surgery. And it takes into account not just medical diagnoses, but also things like mobility, independence, and cognition. So why does frailty tell us so much? Think about what surgery actually asks of the body. The surgery is stressful, not just mentally, but on the biological processes in our bodies. There's the operation itself, the healing, and the weeks and months of strenuous physical therapy. Every bit of that draws on your reserves. A person with more in the tank has more to draw on during the recovery. A person running low has less of a buffer, and it's a steeper climb to get back on their feet. And this is the key. It's a huge part of why one 80-year-old's recovery is not the same as another 80-year-old's. And it's also why some of my 80-year-old patients recover more smoothly than some of my 60-year-old patients. It was never really about the date on the birth certificate. It was about everything underneath it. Even though frailty is very helpful in predicting how patients will recover after knee replacement, it isn't the end-all be-all. Every patient is unique, and this is just one way to help understand how we are all a little different from one another. So, is age a factor in knee replacement? Absolutely. But it's far from the only factor, and it's not the most important one. What matters more is the full picture of your health. Now, I want to be clear that I'm not saying that everyone can or should have a knee replacement. That is a highly individual decision. And for some people, after weighing everything, choosing not to have surgery is the right call. And that's okay. But I hope everything we talked about helps you have even better discussions with your surgeon about whether surgery is right for you. If you're preparing for knee replacement, here's my video on pre-op exercises that can help boost recovery. I'll put another video up here that may help too. If you found this helpful, click the like button. It helps others find it when they need it most. Stay well, and I'll see you in the next video.